We are back here with Erica, and she just told her story of her daughter Avery, who was stillborn. We are. I'm excited to talk about kind of what life has looked like after Avery's birth. So, welcome again, Erica. Thank you so much for your time again.
Thank you, Winter. Thanks for having me.
Okay, so as some context, can you tell us how long ago Avery was born and what happened, kind of around what week she was born and such?
Sure. It was May 25th, 2012, when we found out Avery was stillborn, or when she was stillborn. So 10 years ago. And what was the other question?
Oh, and you were like around 40 weeks,
Yeah.
right? 41 weeks actually, right?
Yeah. So I was 41 weeks pregnant when she was born.
Yeah. And the cause of her passing, can you tell us a little bit about that as well?
Sure. Yeah. We found out that it was due to an umbilical cord accident.
Yeah. And I would highly recommend listening to her story. It was really it's hard, but I'm glad that we were able to get Avery's story recorded. So I would highly recommend that if you want to check that out. So Erica, so when after Avery was born and you guys had her kind of her memorial service with your family, how did those first few months look like for you and Greg, your husband, and basically how did you survive that first
Yeah.
little bit of time?
It was so difficult. I mean, just the basics of everyday life were crippling for us.
Yeah.
Taking a shower, getting out of bed, even just like sleeping was
Yeah.
hard. And I felt like I was having a lot of like night terrors, like dreams that I was still pregnant, that this was all like not like our reality. Spent a lot of time. My dad who came to visit us from
Yeah.
Florida, had returned back home, and he was so helpful for me, like, when I was having those times in the middle of the night. Greg was back to work. He only had about two weeks of time that he took for,
Okay.
bereavement, and then I was still home. So, I wanted him to get rest so that he'd be able to be okay and function at work. So,
Yeah.
I would get up a lot of times and, like, go sit out on my back porch and talk to my dad on the phone to clear my mind, and that was so incredibly helpful to have somebody else to talk to. I'm sure
Yeah.
my husband was like, "Oh my god," we sometimes need some other people to rely on other than
Yeah.
your spouse. So,
He's going through it too, and so, yeah,
yes.
I mean, having some outlets other than the person that went through it with you is always
Yes.
super helpful. It's really nice of
Yeah.
your dad to be willing to chat with you at all hours, it sounds like,
Yeah,
to
well, I mean, he's retired, so he's
he's got time.
he's got time. Yeah, no, I mean, and their life revolved around, me and everything that I mean, my parents were constantly checking in to see how
Mm,
we were doing. We had such wonderful support between our family and friends. We were really fortunate.
yeah.
Yeah.
And Greg went back to work 2 weeks after, which is, I mean, understandable, just because, yeah, bereavement is short, like,
Yes.
bereavement leave is short. How about you? Were you able to take a little bit more time off because you had just given birth to a 41-week-year-old?
Yes.
Like, so were you able to take time off?
Yes. So, yeah, I was given like this 6 weeks time for the delivery, and then I put in a request for, like a personal leave, or
Oh,
I
good.
honestly, it was something like that.
Yeah.
And, so I took a little extra time. I can't remember exactly. I wanna say it was about a total of 3 months time.
Oh, good.
And it was really hard to go back to work, and it was hard mostly to face the people. I worked in an office setting at the time, and now we're partially remote, so
Yeah.
there's not as many people in the office, but it was hard to go back and see people. I'd been working there for a really long time, knew everybody, and most people knew what had happened,
Yeah.
but just having to look people in the eye, like, knowing that they didn't know what to say to me and I didn't know what to say to them, was really hard. But,
Yeah.
I mean, yeah, even, like, the beginning days, like, I don't even know how we got through it. It was just day by day, moment by moment. And yeah, some of those, just like benign things like showering or just knowing what to do with yourself too. Like, how do I occupy all of this time? Like I would just want to be sleeping or
Yeah.
um, when we should have been taking care of a newborn baby,
Yeah.
we didn't know what to do with ourselves.
Yeah.
Yeah.
It really is like, I should be doing something differently. So,
Yeah.
so different, and now, yeah, you're just beside yourself with, like, yeah, you just it's a puzzle in your brain,
Yeah.
and your brain is trying to figure out what's happening, and your body's trying to, like, yeah, something else should be have happened, yeah, and you're
Yeah.
recovering from giving birth and all of these fun things that happen afterward.
I know. I think, sometimes people forget that your baby died, but your body doesn't realize that.
Yeah,
So, your milk comes in. I know
yeah,
people have talked about that, but like your milk comes in, you're like bleeding and you're having all of those after effects. Your body doesn't understand what's happened. So,
yeah,
I mean, in a way, I guess maybe it's sort of a good distraction that I was able to focus on like taking care of myself
yeah,
some. But yeah, it's hard. It is
yeah,
really hard.
really is. You mentioned in your other episode that you have 3 boys, you have 3 other children,
Yes.
3 little boys, and talking a little bit about pregnancy after loss and parenting after loss, how did you guys transition or make decisions to try again? Or
Yeah.
yeah, because I found that decision to be extremely crippling. Like, I don't think I can go through that again. Like,
Yeah.
it was too much. It was too much for a long time there before I made a decision about it.
It was. I mean, we we were terrified to try again, but at the same time, like the saying, empty, like having empty arms,
Yes.
is so true. Like your arms are just aching to hold that baby. And that's all we wanted was to have a baby. And we wanted Avery, of course, but
Yeah.
not having her just really I don't know if I'm saying the right words, but really showed us how much we wanted to be parents,
Yeah.
again. And we took the time to heal physically,
Mhm.
and started our grief journey. My husband and I started going to see a private counselor who
Mm.
specializes in pregnancy and infant loss. So
Oh,
we were
really?
seeing,
That's great.
yeah, it was amazing. So that the bereavement nurse gave me some
Mm.
contacts, and I found the therapist through her. So we were seeing her, I want to say like once every 2 weeks. And then I started going to a monthly support group that was also in my discharge paperwork. So there was a monthly support group that was actually run by that bereavement nurse.
Oh, that's awesome.
Yeah, that was at the hospital that I delivered at. So it was more of a because she's a nurse and I think she's like also a health educator, so she knows how to navigate the conversation and keep it within certain limits type of
Right.
thing. So we went to a group that was led by her. And then I, on my own, also I'm laughing because I just needed all the support that I could get.
Yeah.
And, I felt like sometimes my closest, like best friends, I mean, I'm a people person, if you can't tell. And I like to talk. And I felt like sometimes I didn't want to like wear my friendship thin with them, that like,
Yeah.
they were incredible and so helpful, but it just helped me so much more to be in company with moms and families who like truly understood.
Yeah.
So, yeah, so we were going to the private therapist, the support group that was run by the hospital. And then we were also going to, I was going to another support group called the Tears Foundation.
Oh,
And
okay.
they have chapters all throughout the United States. I don't think in every single state, but
Mhm.
so they offer peer led support.
Oh, okay. And that's
So I
and I
started
would say that
going,
would be a little bit different too, because, like, I guess when we've gone to support groups, it's been peer led. And once again, it feels so, I'm grateful for that, because it's like we can talk about having lost our baby and they get it. Like, they get it
yes.
automatically.
Yes, yeah, and it's not, people aren't afraid to talk about it, or they don't shy away from,
Yeah.
talking about things that feel taboo, or yeah, like they're not just trying to put a Band-Aid on it,
Yeah.
when you hear the things like, "Oh, everything happens for a reason," like, they're not there to say that. They're
Yes.
there to help and support you and bring you through this horrible time,
Yeah.
so,
That's pretty great. I
yeah,
and that's awesome that you sought out that support because that's the way you process things and because it's not I mean, it's like some of those support groups are not for everyone and
yeah,
therapy is not for everyone either, but like knowing you and knowing your personality, I think that like you chose what was right for you. I think that's
yeah.
great.
My husband is, like, the complete opposite of me,
Really?
so yes, at, like, the hospital support group, he would come along with me, but he would just sit there and,
Yeah.
like, rub my leg or pat my back, or, offer me comfort when I would talk, and it was really emotional for me. Sometimes he would speak up and say something, but for the most part, he was there for emotional support for
Yeah.
me, because he knew that's what I needed.
Yeah.
Um, yeah,
And
so
he
he
and it sounds like he doesn't really I mean, like, not process that way, but, like, that is not I mean, he probably has other methods that that have helped him through.
Yeah, definitely more of a private,
Yeah.
he's like you said, he's still processed, he's still grieved, but
Mhm.
just in a much different way.
Yeah.
Yeah.
Yeah. We're all different, but it seems like the women need to talk about things.
Yes, for
It
sure.
helps to talk about things, at least for me too, so
Yeah, and that was a somewhat of a struggle for me when we would
Really?
go to our private therapist. I'd say, like, "I feel like
Oh.
you're not grieving," and he would say, like, "Erica, there's times where I, like, cry in the shower, but you don't know it because I just need that alone time," and
Mhm.
it just made me realize and open my eyes to the fact that, yeah, not everybody processes this the same way that I do.
Yeah.
Yeah.
Or expresses it in a way that, yeah, you see sometimes, like, yeah, just the
So
weeping and
outward,
so
yes.
outwardly, yeah, some people are very private, and the fact that yeah, because I now when you said that, I was like, I'm pretty sure Lee, my husband, would do that too. He would go into
Yeah,
he would make sure that I'm asleep, and then he would go and have a good cry in the living room or
yeah,
when he was in the shower or whatever, so, um
definitely.
yeah. So this Tears Foundation, was it just talking specifically about loss or had any of those parents started to navigate having children afterward? That's one thing I noticed about some of the support groups. They always have like a pregnancy after loss support group that helps navigate those decisions that you are going to be making.
Yeah, so early on, it was mostly just
Mhm.
they have a regular support group for, like, just an after loss
Yes.
support group, and then they do have a pregnancy after loss support group. So, in the beginning, I was only going to their, like, the standard loss
Mhm.
support, but then I became pregnant very quickly after losing Avery. So
Oh,
our
okay.
oldest son, Ryan, was born not even a year. So Avery's birthday was May 26th, and Ryan was born May 7th the following year.
Oh, okay. So
So I
it
got
was very
pregnant.
quickly.
Yes, it was. I mean, so I switched to a different practice because I just felt like that's what I needed to do, and that it felt to me that there were some missteps and errors in
Mhm.
what had happened with Avery that I needed to, I guess, like, wipe the slate clean and have
Yep.
new providers. So we went that route, and the doctor that I was seeing was willing to, work with me very closely and monitor me closely,
Good.
to be sure that I had a safe and well supported and closely monitored pregnancy,
Yes.
which was amazing. So yeah, he told me that once I had a few normal periods, it would be okay to try and conceive again, and I wanna say we got pregnant in, like, the second try, so,
Ah.
or maybe it was the first, because the
Yeah.
timing was so quickly,
Yeah.
but we were very fortunate, but pregnancy after loss is so scary, it's such a long time. Pregnancy, 9 months of time does not go by quickly, especially when you've had a loss,
Mhm.
and that's lingering, in the back of your head about the what ifs,
Yeah.
um, all throughout.
when you said the 9 months is so long, I was like, after loss, it is so you guys, like, I can't even tell you how long it is. It is hard and it is stressful and there's so much anxiety built into it. So
Yes.
I know where you're coming from.
Yes.
Were you guys had you guys talked about getting pregnant that quickly?
We knew we like I said, we knew we wanted to have
Okay.
another baby,
Yeah.
and we're, through going to Tears Foundation, talking with other moms, there were some moms who felt that they needed to give themselves, like, say, a year to
Yeah.
meet all of those milestones and all the holidays and the first year birthday for
Yeah.
their child, that they needed to wait that year. But then there was other moms who were like me and felt that they wanted to get pregnant quickly and
Yeah.
have another baby, because I knew we would be grieving forever. And,
Yes.
like I think that was maybe sort of a distraction throughout the pregnancy was grieving and going through those heavy, hard times, those first anniversaries, those first months, the first Christmas without our daughter. But I guess in my heart, I was, pregnant again. So it was nice to have that hope to
Yeah.
help us through.
Yeah. It changes your perspective on a lot of things, but having that kind of another little baby kind of on the way is really, really nice too.
Yeah.
Anxiety filled, but nice as well.
Yes, for sure. Yes. Yes.
And how was that pregnancy with Ryan? Was everything did that turn out okay? I mean, like in the
Yeah.
sense of like you felt good and everything was checking out. You were getting monitored more, which is great.
Yes, yeah, so, I mean, the pregnancy, it was, like, very similar, s smooth sailing, no issues, other than just, like, horrible anxiety and worry and being afraid. But, yeah, no, medically, I had a really healthy, great pregnancy with him, so
Yeah.
was very fortunate again.
And when he was born, how was that experience?
Oh my just what like, I will say that having had a loss prior, like,
Yeah.
not all babies are special when they're born, but going through what we went through with Avery and then having Ryan be born was just, oh my, what a moment, and hearing that cry and holding him and, oh my gosh, and being able to look into his eyes, and it was just incredible, incredible.
Yeah.
Yeah.
Yes, it
Yes.
it really is. I think
Yes.
yeah.
Yeah.
And then you, basically will celebrate Avery's birthday, like, a couple weeks after he was born, right? Essentially?
Yes, yes. I feel like we have a lot in there. We have Ryan's birthday, and
Yeah,
then
okay.
Mother's Day is
Oh,
tied in
yes.
there. Uh-huh, and then, Avery's birthday, the end of May. And then I did wanna mention, so the one of the things that we do to honor her is, so through the group, the Tears Foundation, they have an annual walk.
Yeah,
That's a big fundraiser for them, and the walk is it's always the weekend after Mother's Day, and I think they purposefully put it there and the timing there, for moms who are grieving, and it
yeah.
just Mother's Day is so hard as it is,
Yep.
so it's nice to have that. So the month of May is very busy for us,
Yeah,
but
it really is.
yeah, but it's nice to have the walk in place because it feels like our way of honoring her without, having to do a whole lot of, like, actual planning myself. It's like kind of like a something that's set in place for us, so
Which is great.
yeah.
We usually obviously have the walk of remembrance in Octobers and stuff, so but it's kind of cool having it in around I mean, after Mother's Day, like, really, that's
Yeah.
I'm gonna have to talk to my local chapter of see if they can
Yeah.
do anything like that. Yeah, and then you went on to have a couple of other sons as well, but I know that you
Mhm.
had some issues, getting pregnant with your last son, is that right?
Yeah, so, our youngest son, I had him when I was 39,
Mhm.
but it took us quite a while to get pregnant. We'd never had, infertility or fertility issues
Yeah,
prior, but I think being on the older side, I know that, like, your egg quality goes down and egg count goes down, and, sometimes things change with your husband's, sperm quality and
yeah,
that kind
yeah.
of thing. So, yeah, we had some difficulty getting pregnant with him, and we ended up having to seek out fertility treatments.
Mm.
So we went through a couple cycles of IUI and then did a cycle of IVF to get pregnant with him. But our IVF cycle actually was not very successful. We went through all of the steps to do a retrieval, but didn't
Oh.
actually end up having any embryos that were
Oh,
fertilized. Yeah,
yeah.
so they like take a number of, and I'm saying this in horrible non-medical terms, but
Yeah,
when you go
that's
through
fine.
IVF, they give you all of these medications to force your body to create a lot of eggs, and then
Yeah.
the eggs are retrieved, and then once those eggs are retrieved, they fertilize them with the sperm, and then they monitor them to see how many embryos you'll get, and that count initially, like how many are
Yeah.
taken, it's never that number. Like, it always goes down because some
For
of them
Yeah.
die or the quality goes down. So I think I only had like 3 eggs retrieved, and none of them made it to become embryos. So
Oh,
it
yeah.
was really so disappointing
Yeah, there's a
to go
grief
through that.
in that as well, like,
Yes,
fertility, yeah, or infertility has its own set of grief because 'cause you're like, "Oh, now my family's not gonna look like how I want it to look either." Like, yeah, it's loaded as well.
definitely. Yeah. So our fertility doctor said to us, I think because of your age, like it's probably better to stick with IUI. So
Okay.
after the failed cycle of IVF, we went back to IUI and thankfully became pregnant with our youngest son, Parker.
Yeah.
Well, let me back up there. So we did get pregnant prior to having Parker.
Oh,
Through IUI. And when you go through fertility treatments, they monitor you super closely. Like you find out
yep,
you're pregnant when you're only like 4 weeks along. It's
yep,
crazy how early in everything you find out
mhm,
and hear a heartbeat and that sort of thing. So yeah, we found out we were pregnant and heard the heartbeat, and I mean the baby's so tiny at that
mhm,
point that it's hard for them to know whether everything's okay or not. But there was a heartbeat and things looked good. Um, for such an early stage of pregnancy, I want to say like 5 or 6 weeks. But we were going back for like regular ultrasounds just to monitor the progression of
yeah.
the baby. But then I want to say around 9 weeks, the baby's heart rate was slowing,
Oh,
and it looked like the baby hadn't grown to how like big the baby should have been.
mhm,
So our doctor told me to wait, and I came back another week later, and she kind of gave me the heads up, like, this really isn't looking that great. Like the baby should be this size, like when they're measuring like rump to, or what, I
y
forget the measurement,
yes,
what it's called, but
yeah,
yeah, so like the measurement was off, the heart rate being lower. She just kind of, I felt like, thankfully gave me the heads up that things may not go well. So I came back a week later, and that's when we were told that unfortunately we had lost that baby.
oh,
I know. So
that
it
was
is so
10
hard.
weeks? That was, like, 10 weeks or so?
10 weeks. Yeah. So it was, it's hard. You're going through, I feel like fertility
Yeah,
has so much more pressure, puts so
yeah,
much more pressure on things to go the right way because it's time and sometimes a lot of money, and your hearts are invested in it. Like, not
mhm,
that your heart isn't in it when you're trying to get pregnant on your own, but when you have all of these other interventions involved
mhm,
and you're getting up at 5 a.m. to go give blood work, and they're doing it very often, like several times a week, so that they can see, like, pinpoint exactly in like where you are in your cycle and
yeah,
when, to do these different procedures. It's just a lot involved, and so I felt like that definitely impacts the loss
yeah,
quite a bit.
yeah, it really does, like, and then always, like, you had a loss after a lot like, on top of yes, like, yeah, your heart does feel like it's way more into it because 'cause you're like, we're doing this really on purpose," and
Yes,
so
yes, yes, yeah. I know. It was, and I think it was hard too because nobody, like, we none of our family, well, my mom did know that we were going through this, but
Yeah,
we didn't our friends didn't know. We weren't really like, they knew that we were going through treatments, but we didn't tell them that we were pregnant just because we wanted to, like, kind of keep things to ourselves for a little while, and so I think that was hard, in the sense that you don't have the support like you do when your baby is full term. It's just
exactly.
yeah,
Yeah,
yeah.
miscarriage also is just another really tricky area. Yeah, because a lot of people don't say anything for a good
Mhm.
long while before.
Yeah.
Yeah. Oh, so I'm assuming when you guys did get pregnant with Parker,
Yes.
then
Yeah.
that was probably, I mean, obviously you were probably worried. I would be worried again because you're just like, oh, that should have worked, or like we were
Yes.
pregnant
Yeah.
for a time there.
Yeah, we were nervous and we were scared, and at that point we were kind of questioning, are
Mm,
are we kind of at the end of our rope here with this? Like, is this a sign? And like, we didn't know how much longer we were willing to go through these treatments. We already had two living children that we were so thankful for, and our hearts felt like we needed one more little kiddo to complete our family, and I'm glad that we pushed forward and now we
yeah.
have our youngest. But yeah, it was scary. We were afraid to keep going, and what if this resulted in the same,
Yeah.
loss again? Like, I didn't know if I'd how I'd be able to pick myself up after. And it's hard when you have kids and you're trying to
Yeah.
grieve, but also parent at the same time. So that definitely weighed on us as well.
Yeah, for
Yeah.
sure. Erica, what are your like? So you, because I just keep thinking of like you having had Ryan, your oldest son, after Avery, pretty close to after you lost her, and then also just even having your second son and your third son. I just, how has pregnancy and also parenting after loss looked like for you? Has that changed any perspectives for you and how you parent your kids, your boys?
Oh gosh, I mean, parenting I mean, it's hard as is,
Oh
but
yes,
then, you're trying to navigate this journey of grief, like, along with caring for your living children. So it is difficult. I'm sorry, Winter. I'm just trying to think of my thoughts here.
Oh, it's a
Um,
big old question though, because
yeah.
parenting in general is a huge old, yeah, and then parenting after loss is like, because I don't know about you, like when I parent, like it really changed my perspective of like having lost a son. I'm like, oh man, like you mentioned before, you're like TV was very trivial, or and that's the thing. I'm like I feel like it changes your perspective as a parent when you're like
Yes.
anything can change, things can change on a dime, and I try really hard to capture a little bit more moments when I would be just, watching TV, like you said, or on my phone or
Yes.
something.
No, that's so nicely said. I feel like, we value time a little bit differently,
Yeah.
and like, make it are purposeful in making the time to spend as a family, and try not to get swept up in oh, the house has to be cleaned and this has to be that,
Yeah.
try to really spend that time. But I feel like on the negative side, we worry so much. I mean, and I know as parents, we worry as
Anyway,
is,
yeah.
but I feel like it heightened, like, going through loss has really heightened my sense of, like, just anxiety and fear, and, you know, wanting to be in control of every little bit of thing that I can.
Mm,
I mean, like, my kids take the bus to school, and that makes me nervous. Like, I feel like we have a heightened sense of anxiety and, like, nervousness for them, and
yeah.
setting them out in the world. It's scary because you only have control over so much. Yeah.
Yeah. Oh, yeah. When you said that, I was like, "Oh, yeah, I do that too," actually.
Yes.
Yeah, because
Yeah.
there's a flip side of the coin of where, like, you really treasure things, but then at the same time, you kinda hold onto it really tightly. At least I do, now that you say that.
Mhm. Yeah. And it's hard. My mom will say to me, like, "Oh my gosh, like, you need to, like, chill out," or, but it's, when she has the kids, and I'll say, like, "Are they okay? To make sure you do this, and she's like, "I know, I know." But
I
it's
raised you.
Yes, but it's so hard to let go of that
Yeah.
because they're your heart, and, there's always that little thought in the back of your head, like, "What if something could happen?" And
Yeah.
that fear can sometimes really take over.
Yeah. Is
Yeah.
there anything that you do to, like, combat that fear for those who are, I mean, as words of advice for those who may be parenting after loss or are maybe pregnant after loss and
Mhm.
are gonna have to navigate those waters?
Gosh, that's a tricky question to
That's a
answer.
tricky question, isn't it?
Yeah. I mean, I mostly try to just push the thoughts aside, like take a breath, reassure myself that, it's okay, that like they're gonna be okay. And I think also like sometimes technology is helpful. Like our son has like our oldest son has a watch where he can
Oh, okay.
like one of those
Check in
watches
or
where they
whatever.
can, yes, yeah. But it is difficult, just trying to navigate that, trying to quiet your mind from those negative thoughts.
Yeah.
Yeah.
Yeah, your thoughts can totally get out of control, at least mine do, and so I always have to put a check on them. That's what helps me
Yes,
when it
yes,
comes to
yeah.
that. So, and I know that you have in the past, facilitated actually one of these peer supported support groups.
Mhm.
So tell me a little bit about how that has looked and why did you decide to do that? Like why did you decide to go ahead and be a moderator for that?
Sure, yeah, so through the Tears Foundation,
Mhm.
the pregnancy and parenting after loss support group was just so instrumental for me in
Mm,
navigating my way through pregnancy after, especially with our oldest son,
mm,
after
right.
losing Avery, that I just felt like in my heart compelled to like help other moms and give back and let them see that they can make it through this journey, as really difficult and hard as it may be, that you'll have another baby, and
Mhm, mhm.
um that there's support to guide you through this, that you're not alone. And because it is just so challenging, that long time to make it through the pregnancy. I think it just helps to have that monthly check-in, to talk with other moms, like, "Are you feeling this way? Is this
Mm,
normal?
mhm.
What do you think about this?" Like, have a sounding board that's somebody other than your immediate family.
Yeah.
It's just so helpful. So, yeah, we have a support group that's once a month, and, we talk about all sorts of things. It's no set topic, it just happens to be whatever's on people's mind that day,
Mhm.
but it's nice, and it's just helpful. It's healing for me to be able to give back and help other people through the same journey.
Yeah.
Yeah.
That's one thing I've noticed is that a lot of our moms that we talk to have this, like, they feel compelled to give back to people, like, give back to the community that helped them through how difficult a loss is. So, yeah, I think that's really cool that you do that because we
Yeah.
benefited from some amazing moderators that had gone through loss as well. I'm grateful for them.
Yes. Yes.
Can't make it without it, so I think that's
Yeah.
awesome.
No.
Erica, this has been so great to talk to you, especially about the parenting after loss and kind of trying to navigate that and what that looks like because some of the people that listen to this are not that far along and may not feel like that there is hope on the horizon of how things are going to look for them. So I think you bring some hope and so I'm grateful for that. Is there any a last bit of advice you would like to share with our listeners so that that will carry them off to the rest of their day?
Yeah. I would just echo what you had said about, there is hope. And when you're in these early stages of loss, it often feels like you can't make it through the day-to-day things, and you don't know how you'll ever survive this horrible tragedy that you've been through, but you will. And it takes time, and but you will see, you'll have happiness. And I mean, I remember the first time I smiled and first time I laughed about things, there was that sort of sense of guilt that, how could I be smiling or laughing after going through something so horrific? I felt like I was like dishonoring Avery, but I know she would want me to be happy. I know she would want me to find joy and the good in things and to go on and have more children. So, there is hope, and just hold on to that. It's a bumpy ride, but you'll make it through.
That's perfect. Thank you
Oh,
so much
thank you,
again,
mentor.
Erica.
I wish I could give you a hug.
I
Thank you
know.
so much.